Hi, welcome to SMU Talks. We're having a short interview with Dr. Francesco Porpiglia. He's a pioneer in AI incorporated and also augmented reality incorporated surgery. He works in Turin, Italy, in hospital prior San Luigi and now
Candiolo.
Ospedale Candiolo. All right, very nice to having you here,
Thank you
Professor
so
Porpiglia.
much. Thank you so much.
Well, I have some questions. Where do you think AI and augmented reality is leading to surgeons and surgery right now?
So I think that the combination of augmented reality and artificial intelligence is extremely important in the near future because thanks to this innovation, you can improve the quality of our surgery and we can improve as well the results for patients. We have a good experience we apply this technology for kidney surgery, but now we have published only a few days ago one randomized studies in which we demonstrated with this technology, augmented reality, with artificial intelligence, guide the surgeons for reducing the positive surgical margins and to improve the quality of life and the oncological results in the patients.
Thank you very much. And with all the research and work you have done so far, what would you think is the main lesson learned in AI and augmented reality in surgery?
So the best application?
Yes.
So I think that the best application now is in prostate cancer. And in the near future, we try to apply this as well in renal cancer. The reason why we have some limitation about this technology is that we need to improve this technology because we want that augmented reality become totally automatic. And so this we have reached these results for prostate cancer, but we are not able up to now to reach the same results for kidney and so for partial nephrectomy. I think that we need to improve in order to individualize the landmarks or other parameters in order to have an automatic overlapping as well for kidney surgery.
And speaking of prostate cancer, and specifically in nerve-sparing and tissue-sparing surgery, what would you think, or what is your advice in conserving tissue against maybe sacrificing some oncological results as surgical margins?
So I think that we need always to find a compromise, but it's important to have a good information of the patients about these sexual activities, first of all.
Yes.
The second one is important to have good information, precise information about the histological examination, MRI. So there are many clinical, personal of the subject of the patients and the oncological parameters that should be considered in order to obviously obtain more information and to obviously apply a compromise, the best compromise for patients in order to obtain obviously the efficacy of surgery, to obtain safety in terms and the improvement of quality of life. But if you don't have good information, obviously your surgery can be compromised by the lacking of data, and so the surgeons now they are able to do a good surgery in general because the robotic surgery improve the quality of surgeons. But I think that often we don't have a good information about MRI and about histological biopsy.
Dr. Porpiglia, you have done a great job and you're leaving a big legacy in pushing this field in surgery. What would the Professor Porpiglia from today recommend to the younger Professor Porpiglia or to the younger surgeons?
So the young surgeons, I can recommend the young surgeons to work every day, because in my experience, if you'd like to become the good surgeons, it's not enough to do 1, 2, 10 operations, but to do to attend, first of all, the operative room every day, to follow the patients. It's important to have a good relationship with the patients, to have the feedback of the patients, and moreover, spend a lot of time for studying and for for following your mentor. It's extremely critical to select the best mentor for you, that he can transmit to you the most information and the culture that he matured and he accumulated in his life, in his professional life. If you have a good mentor, the young urologist is obviously is able to accumulate receive the experience of the surgeons, of the mentor, I think that so you can create the good surgeon as well for the future. You don't need to stop to read only the book, only the papers, and to do research, but you need as well to do practical work.
Thank you very much. It's been a pleasure having you here.
Thank you so much.